surgery or blame the patient. All right. It's always a bit of both, I think, and I got just mainly one or two messages. My goal is to see if I can give you with each lecture one or two message. I still work for the same companies. All right. So this is just to see if you're awake. When we classify new tools, it is either revolutionary technology or technology looking for an indication. Thanks very much. I feel pretty good. All right. Why only 7 nodes? What do you mean the report? I just got 7 nodes. It was interesting. I was in Cleveland for my first 2 years, and at the clinic, that was my first job. And I would do a resection, cheesy little thing. I'd get 30 nodes. I'd do the same resection or better at Leahy, and I would get 6. And I was like, it's obviously I did a lot worse surgeries in Leahy than I did in Cleveland. You know, is it me? Is it the pathologist? Is it the tumor? And it's probably a combination of all three. And I don't take it so hard now when we don't get it, but I like to always blame. Here's the conclusion. So nothing magical about 12. You won't always get 12. If you reevaluate, you won't change the stage, but you probably will change recommendations. And here's the message, the take-home message. Chemotherapy should be offered to your patient if you don't get 12 lymph nodes, or if you get less than 12. And I think that's something which many of us probably miss, you know, that the patient should get chemotherapy. And the important part of this is if you reevaluate, you'll probably get to 12, and then they won't need chemotherapy. So, and if you're going to do CME, that's an important thing to remember. Okay, that's your clue. All right, here's this. The American Cancer Society says in 2017 predicts 95,520 cases. Not 30 or 40, but 20. That's their number. All right. How is that different than the year or 2 years before? Anybody know? All right. So I've been looking at this because I'm giving this talk, and every year it's clicking down by about 5,000 colon cancers a year. The incidence of colon cancer is dropping by about 5,000. So just think about what's going to happen, not in my lifetime, I don't have to worry because I won't be doing this much longer. But in your younger, so I see some younger, hopefully residents, in your lifetime, you better start thinking about other things like endoluminal surgery because colon cancer is going down. Okay, that's an important factor. So that's probably another good message. We think that nodes allow for accurate staging, that if you detect nodes and they're positive, that allows them access for chemotherapy. And there are, a lot of people say you got to get 12. But there are a lot of studies like this. There are a couple of them that looked out. The lower bar is if you had less than 1 to 7. The higher bar